Continuing our series on medical terminology, we're now looking at the respiratory system. Now, some of the terms we're going to be considering relate to normal structure and function, but many of the terms relate to respiratory disorders and disease states. So as you work your way through this presentation, hopefully you'll learn more about the normal structure and function of the respiratory system, and particularly you'll learn more about the disease states affecting the airways, the lungs, and to some extent the tissues and structures surrounding the lungs and the airways. Now, in this photograph of a model, we see the respiratory passages above the hard palate of the mouth and below the sinuses. Near the top of the picture there, you can probably see the pituitary gland. We also notice that the nasal passages at the back are continuous with the nasopharynx, further down the oropharynx, and further down still the laryngopharynx. And towards the bottom of the picture there, you can see the epiglottis. So when we're talking about the nose, nas or naso is the common prefix. So nasal is pertaining to the nose. Nasoseptal is the septum separating the two sides of the respiratory passages. The nasopharynx is the area at the back of the nasal passages, which is continuous with the oropharynx below. Quite commonly, we use nasogastric tubes. Naso, nose, gastric, stomach. So this is a tube that goes through the nasal passages, down through the pharynx, into the esophagus, down through the esophagus, and into the stomach. And we can use nasogastric tubes to take things out like gas or potential vomit, gastric secretions that we don't want. Or we can use nasogastric tubes under appropriate circumstances to put things in, like fluid and nasogastric enteral feeds. Nasoscope, to look at the prefix again, would just be a device for looking into the nasal passages. So that would be, a nasoscope would be used for nasal endoscopy. Endoscopy is any time we look inside. So anytime you see this term nas or naso in front of a word, it's going to be to do with the nose and the nasal passages. Now, carrying on with the nose and nasal passages, we see that rhine or rhino is another common prefix that denotes the nose. So, for example, rhinitis is inflammation of the nasal passages, regardless of the cause. So it could be caused by an irritating gas, or very commonly it's caused by a viral infection. But it's inflammation of the nasal passages. Rhinodynia refers to pain. Dynia is one of the suffixes that means pain. Rhino, of course, to do with the nose. Now, rhinorrhagia refers to excessive fluid flow. That rhagia part refers to flowing. Now, it doesn't have to refer to blood, but very often rhinorrhagia is used to describe a copious nosebleed where there's a lot of bleeding. But the other term that often is used to describe a nosebleed is an epistaxis. Now, epistaxis is probably a bit of an old-fashioned word, but staxis is a term which means bleed. It comes from the Greek, meaning to shed in drops. So epi means outside or external. So epi means outside or external. Staxis means bleeding. So it means a bleed that is bleeding to the outside of the body. But in practice, we only use the term epistaxis to describe a nosebleed. Rhinorrhea, again, the rhea part means to flow. So a rhinorrhea is a flowing nose. It is a runny nose, as you might get with a cold. When fluid is running from the nose, there is a rhinorrhea. It simply means a runny nose. A rhinovirus is a virus which will infect the nasal passages, and this of course is exactly what causes the common cold. The common cold is caused by rhinoviruses, and there are many different types of rhinoviruses, and they genetically change from time to time, which is why you can get colds where you can get one cold after another under some circumstances, because it's a different virus. And even though you make antibodies to one of the viruses, then you can still be resistant, or you can become resistant to some viruses if you're exposed to them. But there'll be other viruses that you are sensitive to because you haven't been exposed to the genetics of that particular virus. And of course, the cold viruses, the rhinoviruses, are subject to genetic shift and drift as well, so it's an ongoing problem, I'm afraid, that we have colds. Rhinoplasty. Now, plasty refers to moulding or forming, but plasty usually is used in the context of plastic surgery. So rhinoplasty would be plastic surgery to the nose. So this could be done after disease, or it could be done after trauma, and it's also done for cosmetic reasons when people don't like the shape of their nose. That there can be a rhinoplasty. So rhine or rhino, also pertaining to the nose. So moving down the conducting airways, we come to the pharynx. Now the pharynx is in three components: the nasopharynx at the top, then the oropharynx, and then the laryngopharynx. So the pharynx it's one conducting airway really, but it's divided into these three components. And the air from the pharynx will go through the glottis at the top of the larynx before the air passes down into the trachea. So the next set of terms we're looking at are related to this structure, the pharynx. So pharyng or pharyngo is referring to the pharynx. So pharyngeal simply means pertaining to. So pharyngitis, inflammation of the pharynx. Pharyngoplegia, paralysis of the pharynx, probably for some neurological reason. Or the pharynx at the end as the suffix. Oropharynx, as we've noted, is the component of the pharynx behind the oral cavity. So fairly obvious usually when the pharynx is being referred to in terminology. Now moving down from the pharynx to the larynx. And here we see the thyroid cartilage at the front of the larynx and its anatomical position in the neck. So on this model we see an i-gel laryngeal type mask airway being fitted. And we notice the tongue at the front, the epiglottis. We can see the vocal cords as we start to look into the larynx. The epiglottis covers the glottis, and the glottis is the hole or the aperture at the top of the airway. So let's think now about the terminology related to the larynx. Well, again, with the larynx, it's usually fairly obvious when this structure is being referred to. So laryngeal is just pertaining to. Anything to do with the larynx is laryngeal. Laryngitis, inflammation of. That might mean it's rather difficult to speak because the vocal cords will be inflamed. Laryngospasm is contraction. Sometimes the vocal cords can go into spasm, occluding the upper airway. A possible cause of asphyxia. For example, laryngospasm can be induced by contact with cold water if someone is drowning. Laryngostenosis. Stenosis means a narrowing. So a laryngostenosis is a narrowing of the larynx, again potentially causing obstruction of the upper airway. Laryngoplegia. Plegia means paralysis of. And laryngectomy would be a surgical removal of the larynx, very often for cancer in that area. The trachea is the main airway, starting just inferiorly to the larynx, just underneath the larynx, and ending at the bifurcation into the left and the right main bronchus that go into each lung. So, trachea, tracheo, tracheal means pertaining to. Tracheitis would be inflammation of the trachea. Tracheostomy, now ostomy means an opening into. So a tracheostomy would be when we make a surgical opening into the trachea to bypass the upper airway and to facilitate greater ease of ventilation. Tracheostomy. Tracheostenosis will be a narrowing of the trachea. For example, if someone inhales hot gases, there can be an inflammatory reaction within the trachea, causing swelling, occluding into the lumen of the airway of the trachea. There would be a tracheostenosis. Tracheoesophageal would be where there is a relationship between the trachea and the esophagus. So, for example, a child might be born with a congenital tracheoesophageal fistula, meaning that when the child feeds, the feed is able to get from the esophagus into the trachea, causing coughing and choking. Now, as we've noted, the trachea divides into the bronchial passages, first the right and the left main bronchus, then into lobar bronchi and progressively smaller passages of the bronchial tree. Now, bronchus is singular, so there will be one bronchus or two or three or several bronchi. Bronchitis is inflammation of the bronchial tree, one of the components of the chronic obstructive pulmonary disease we see so much of in our hospitals. Bronchiectasis is a pathological dilation of the bronchial passages. So again, usually fairly obvious when the bronchial passages are being talked about in medical terminology. So here we have some more prefixes related to the bronchial passages. Bronchogenic means beginning in the bronchial passages. So, for example, there might be a bronchogenic carcinoma, which would be a carcinoma which began in the bronchial passages, probably caused by smoking. Bronchoscopy. Oscopy means to look. So a bronchoscopy would be passing a fibre optic instrument into the bronchial passages. Although I do remember when I was a young staff nurse, we used rigid bronchoscopes, but thankfully I haven't seen those for a long time. They're fibre optic. They go in, visualising the bronchial passages. Bronchoscopy, using a bronchoscope. Now, there's different forms of pneumonia, and there's different ways we can describe pneumonia. Pneumonia is infection in the alveoli, in the level of the tissues in the lung. And we can describe it anatomically. So, for example, a lobar pneumonia could be a pneumonia affecting a lobe. A bronchopneumonia is affecting all of the bronchial passages, so it's a more global pneumonia. So bronchopneumonia would affect both lungs, and you get patchy consolidation over all of the lung fields. Consolidation caused by the accumulation of inflammatory fluids in the alveolar air spaces. Clearly a life-threatening condition. Bronchopneumonitis, well, we see the broncho part, the itis on the end means inflammation of, and pneumo means to do with the lungs. So bronchopneumonitis would be inflammation of the bronchial passages and the lung. Now, bronchioles are the microscopic or the very small bronchial passages. So the larger bronchial passages are held open by rings of cartilage, and as they become progressively smaller, they become bronchioles. They lose their rings of cartilage. It's the bronchioles that go into the alveoli and the air sacs. And it's interesting to note that when you have ole on the end, that means reduced in size. So a bronchiole is a small bronchial passage. Pleura or pleuro is referring to the pleural membranes. So round about the lungs we have the visceral and the parietal pleural membrane. The parietal pleural membrane is attached to the inside of the thoracic cavity. The visceral pleural membrane is attached to the surface of the lung, and between the two there is a negative pressure and a layer of serous fluid to facilitate expansion of the lung when the chest wall expands. So pleural remains to do with these pleural membranes. Now a pleural effusion would be where there is a collection of fluid between the visceral and the parietal pleural membrane. Of course, that effusion is going to take up space, so that's going to reduce the volume of the lung. And if it's severe, it can cause a lung collapse. So, for example, there might be a malignant pleural effusion caused by the presence of malignant tissue, and that might need tapped. It might need drained to allow the patient's lung to expand, to allow them to breathe more easily again. Now, pleuritis, obviously inflammation of. But pleuritis is not a term we use commonly. When there's inflammation of the pleural membranes, we normally use the term pleurisy rather than pleuritis, but it means the same thing. So pleurisy or pleuritis, inflammation of. And when the pleural membranes are inflamed, the pleural membranes are very sensitive to pain. So the inflamed pleural membranes, as they move against each other during the process of inspiration and expiration, causes a sharp stabbing type pain. Very painful condition, pleurisy. And if you want, you can use this term pleuralgia. Pleuralgia is pain from the pleural membranes. So pleuralgia is a symptom of pleurisy. And the algia bit on the end, the suffix algia, means pain. So pulmonary means to do with the lungs. So the pulmonary arteries are going to carry blood from the right ventricle through the pulmonary arterial system to perfuse the capillaries which surround the alveoli, the pulmonary capillaries. Once that blood has been oxygenated and given up its carbon dioxide, it's going to return to the heart, to the left atrium via the pulmonary veins. So they're arteries, veins, capillaries to do with the lungs. And of course, as always, an artery carries blood away from the heart and a vein is going to carry blood towards the heart. Now, a pulmonary embolism is something which would travel through the pulmonary arterial system in the circulation. That's not supposed to be there and could well block off parts of the pulmonary arterial blood supply. So, for example, if there's a deep venous thrombosis, part of that thrombus can embolize, giving rise to potentially numerous emboli, which would return to the heart in the systemic venous circulation, go through the right side of the heart, out of the pulmonary artery, and can then lodge and therefore occlude parts of the pulmonary arterial system, a pulmonary embolism. And a large pulmonary embolism, of course, can be an immediately fatal condition. But any pulmonary embolism is clearly a serious medical situation. Now, the blood pressure in the pulmonary artery is typically a lot lower than that in the systemic circulation. This makes sense because blood from the left ventricle going out of the aorta has got to go all around the body, whereas from the right ventricle in the thoracic cavity to the lungs, the distance isn't that far, so the pressure doesn't need to be so high. So a mean pulmonary arterial pressure of between 8 and 20 at rest is considered normal. But if the mean pressure in the pulmonary arteries goes greater than 25 millimeters of mercury at rest, that would be pulmonary hypertension. There's various causes of this. For example, it can occur in chronic obstructive pulmonary disease. And when there is hypertension in the pulmonary artery, that can lead on to right ventricular enlargement, right ventricular hypertrophy, right ventricular failure, and as a cause of congestive cardiac failure. Pulmonectomy, well, we see the word ends in ectomy, so that would mean surgical removal of a lung. And we use pulmonary in front of lots of things. So if there's fluid in the lungs, that would be pulmonary edema. If there's fibrous tissue accumulating in the lungs, that would be pulmonary fibrosis. So it's to do with the lungs, pulmonary. Pneumo means to do with air or gases or respiration or the lungs themselves. It's where we get the word pneumatic tyre from. So a pneumatic tyre is a tyre filled with air. So pneumonitis, inflammation of a lung. Pneumonia refers to infection at the level of the alveoli, where inflammatory fluids will collect in the alveoli, usually a severe bacterial condition. Pneumoconiosis is a disease of the lung due to inhalation of dust, where there's inflammation, coughing. You'll cough the dust up initially, but over time there can be degeneration and fibrosis of the lung. Very often people that work in very dusty environments. Pneumonectomy would be removal of a single lung, clearly a fairly drastic procedure. Now, we use the term pneumococcus quite a lot. This is actually a sort of a shorthand for Streptococcus pneumoniae, and this is the pathological bacterium which causes many of the cases of pneumonia that we see. So pneumococcus is the term we use to describe the bacteria, etiological in many cases of pneumonia. Although having said that, pneumonia can be caused by many other viruses and bacteria in addition to the pneumococcus. Now, pnea fairly literally means gas or air, but we usually use this to refer to the process of breathing. And this is one of the words that's a bit confusing because there's an alternative UK and US spelling as we see here. So apnea or apnea, a means without. Whenever you see a or an in front of a word, that means without. So apnea means there is no breathing at all. The patient is apneic. Dyspnea, well, dys means abnormal or painful. So dyspnea is difficulty breathing for whatever cause. Orthopnea, now ortho actually means straight. So orthopnea is difficulty in breathing when the person is straight, and it actually means lying flat. So that may well be caused by pulmonary edema. So if a patient is orthopnic, they have difficulty breathing when they lie flat, but then when we sit them up, they can breathe more easily. They are orthopnic. And very often we have to manage these patients leaning forward in the orthopnic position. Tachypnea is rapid ventilations for whatever reason. So tachypnea could be quite normal during exercise. But of course it can also be an indication of a disease such as pneumonia. And bradypnea means slow ventilations, as might be induced by opiate overdose, for example. Thorax means to do with the chest. The thoracic cavity is that which is inside the chest cavity, below the ribs and intercostal muscles and above the diaphragm. So thoracic just means pertaining to the chest. A thoracotomy, otomy means incision or to cut into. So a thoracotomy would be an opening of the chest by a surgeon. Thoracocentesis, centesis refers to a surgical puncture. So a thoracocentesis might be a necessary procedure, for example, to decompress a tension pneumothorax. But from a terminology point of view, usually fairly obvious when the chest or thoracic cavity is being referred to.